certified nursing assistant, how to become one, what exactly do they do, where can they work, how I can help you become one. Let's talk about it, okay? So I'm Erica. I'm the owner of Love Range Medical Training Center. I am in Gainesville, Florida. I wish I was nationwide. I have so many people reaching out to me from so many different areas. I do offer an online course, but let's talk about certified nursing assistant. So a certified nursing assistant, sometimes referred to as nurse aide, a CNA is what you mostly hear people refer to certified nursing assistants as CNA. They assist with direct care of residents, patients, any assistance they need, bathing, helping them eat, helping them get dressed, just talking to them, just some companionship. There's a lot. Your CNA's role is very, very important, okay? I was a CNA right out of high school for about 8 years, became an LPN in 2003, and I am currently a registered nurse since 2017, okay? I opened up my business, Love Range Medical Training Center, here in Gainesville, Florida in 2022. So I've been in the nursing field my entire life. I worked in almost every area of nursing, even as a director of nursing. So I have a wide range of knowledge. So I'm definitely, I would think, an expert in my field, okay? So let's talk about CNA and how to become a CNA. So first thing, I'll tell you what a CNA is. Let's talk about how to become a CNA. And I am in the state of Florida. Now, just know that some of the state's requirements are a little different, so I'm referring to the state of Florida, okay? The exam is given through Prometric. They are a third party for the Florida Board of Nursing. So the Florida Board of Nursing is who you will be certified through once you take and pass your exam. But your exam will be administered through Prometric, okay? You will pick what site you want to take your test at. So that depends on what area you're in. I'm in Gainesville. Most people take their test at Gator CPR. That is the only approved site here in Gainesville, Florida at this time. I tried to become a test site. I didn't have everything I needed to become one, but I know that is on the list of goals coming, okay? I would love to become a test site. So Love Range will be a test site one day. But for now, Gator CPR in Gainesville is the only location that gives the Prometric exam, okay? So let's talk about it. CNA exam, there are 60 questions for the written portion. So there's two parts to the CNA exam, Certified Nursing Assistant exam. There is the written part, which is 60 questions, and then there's the skills portion. You have to do 3 skills, including, and then hand washing would be technically number 4, okay? So you need to be, prepared for the written portion and also the skills portion. My CNA prep is a 2-day course. I pretty much do everything I need to do to get you ready for that exam, okay? So that is my goal in 2 days. Day 1, I'm going to get you registered for the exam. I'm going to go over everything that I can to help tell you what things you should not do in that exam. My goal is to help you avoid mistakes. So, with the written part, that's just mostly me going through. So the second half of my first day, so day 1 of my course, you're going to come in. We're going to get you registered for the exam. I'm going to go through everything. We'll watch some videos. I'm going to talk to you about what to avoid. Most people learn by knowing what they should not do, okay? So I'm going to talk about some of that. That's going to be the first part of the day. We're going to go through some videos. I'm going to teach you and show you the things that you want to make sure you don't do, okay? The second half of day 1, we're working on the written portion of the test. I'm going through questions with you. We're going to go through a PowerPoint. Before you leave, at the end of the day, we're going to do a practice exam directly from Prometric's website, so you can kind of get a feel of how they answer their questions or how they word their questions. So my goal is to teach you how to break those questions down. So that is a busy day part on day 1. That first day, 10 a.m. to 3 p.m. Okay, day 2 is all hands on. So when you come in on day 2, we're in the lab. We in the skills lab. We are in there hands on, putting our hands on mannequins on each other, because you're going to be paired up with a partner, another student that's there for the exam. So you'll use a mannequin sometimes you're going to use a real person. So we get in the lab and go in there and do hands-on, how to transfer people, how to do hand care, nail care, how to transfer from a bed to a chair. There are 22 skills, you guys, that you got to know for this exam. That's a lot, okay? So some people can go to you, basically challenge this test. You don't really need me to take this test. What I tell people that taking a prep course is going to prepare you. If you're somebody who have real bad anxiety or getting nervous in front of people, it's just going to help you not skip those steps that's going to fail you. So my course will definitely help you with that. I have a really high pass rate on this exam, in the high 90s. People do really well, okay? So I know what I'm doing. I can get you ready for this exam. You will be ready when you get there. You will be ready to go in there and not have too many distractions, be able to know how to tune everything out so you can take this test, because there's 22 skills that you have to know in advance. and there's only 3, and you won't know until you get there what those skills are, right? So that's the hard part, is that you got to know every skill, and now, because you just don't know what you're going to get. And we're going to hope for the best, that we get the 3 easy skills. Of course, hand washing is number 4. So that is the goal. So day 1 is pretty much all that other stuff, and then day 2 is hands-on, okay? Now, when you get ready to take your test, and I try to encourage people to go ahead and pay for their exam day 1, when they come for their first day of class. That test is $150. I'm in Florida, keep in mind now. The test prices are different in different areas. But for Florida, the Prometric exam is $155 for both parts. I encourage you to be prepared to pay for it that day, because once you pay for it, you have within 7 to 10 days, you should have a test date. When Prometric send that test date to you, it's going to already be scheduled. You don't just go and pick your date. It's already scheduled. So they're going to be sending you the date, and it's going to be like, you need to be here at this time. Now, you can definitely reschedule that exam if you do it in enough time in advance. If you don't, you have to pay to have it rescheduled. But if you reschedule as soon as so if you know that you're not going to be able to make that day, I really hope that when you pay your money, you keep in mind about the time frame, because you really want to go ahead and take the test. I'm just a faith-based believer, so I believe the date that's appointed to me is on purpose, and I don't like to change the date, but just understand that sometimes things happen, you can't avoid it. But I do believe that this date was picked, and I'm just thinking it's in the universe, I need to be here on this date. So I just try to encourage people to take the date that they give you, so you can, not mess up whatever aura's going on, okay? But that's just me and my thinking. Just know that if emergency happen, things happen, you may have to reschedule that exam, okay? But if you don't give them enough 5 days, it has to be prior to 5 days before the exam. If not, you're going to have to pay the fee. It's $35 to reschedule that exam, okay? It's a lot. I teach you a lot in that class. I just want you to know that basically that is what you need to take the test. You will get your results right then. So once you're done with the exam at the location that you choose, you're going to know before you leave whether or not you passed or not. So that's why a prep course is super helpful, because it's going to help you be prepared better, teach you all the medical stuff, especially for people who's coming into the medical field, have never been in that area. It's a lot of medical terminology that you just don't know, and just so many things. Is dealing with Foley catheters, how to empty a urinary drainage bag, how to do intake and output. It's just a lot of things that you need to learn. And so also for me and my students, I allow them to come back a day or 2 before their test. Like they know their test date is on Wednesday. They'll come back to me probably Monday or Tuesday just to do a quick hour review, so we can just make sure that I can screen, tweak anything that they're doing incorrectly. And you don't know how many times I have had people come back and I've caught things, and literally the things that we went over was exact skills they had, okay? So my students do really well. So if you are interested, my course is $350 for the CNA prep course. I'm going to add the link, the website to the screen. It's $350 and the exam is $155, and you will also need a level 2 background. That level 2 background ranges anywhere from $50 to $80 if you have not had one in the last 5 years. If you have, they will find it, okay? But if you have not, you have to get live scan. I'm sorry, I went blank. You'll have to get a live scan. You can't go to the sheriff's department. It has to be a live scan. That's what it's called. So you can Google live scan. If you know you're interested in taking it, you can actually go ahead and do that, because that is good for 5 years. It goes into a program called Clearinghouse. So Prometric them can find that when it's time, okay? Once you take and pass your exam with Prometric, you are good. You have to be recertified for 2 years, but you will be certified through the state of Florida or whatever state you're in that you take it in. But you will, for the people that's here in Florida, you will be certified through the Florida Board of Nursing. And usually with a day or 2, you can pull your certificate license number off the website. So yes, if you are interested, new year, new you, new goals. We out here trying to make some things happen in 2025. Go to my website and book it, okay, and do it now. Now the deposit is $100, okay. I do offer sales or affirming afterpay. When you get ready to check out, you can click one of those options. But if you're gonna do the payment options, you please shoot me a text. My number is going to be on the screen as well. Send me a message, because I need to go in there and fix it where all the money is due up front. So if the $350, if you didn't know that you need help with that, let me know so I can go require all that money due up front, because on my page right now, on my website, it's $100 deposit and the rest is due the day of class. So the sales or firm going to try to get coverage just a deposit. That's the only thing that's showing required due right now. So just shoot me a text, say, hey, I'm going to go apply for some assistance. I'll go in there, adjust it right quick for you, so you can go and apply for your payment option, and then I can revert it back once you're done, okay? Hope this helps somebody. If you're interested in becoming a certified nursing assistant, do you know how important that role is? You know how many people you can help? Also, you can travel with this, okay? So I'm just saying, this is a huge opportunity for anybody who's been talking about it and ain't being about it. Now is your excuse. So if you see this video, this is your excuse to go ahead and let's get it done. Go to my website and book it now, and I look forward to seeing you in class. I didn't tell you where you can work at. Long-term care, any nursing home, okay? Hospital settings, home health, they hire CNAs as well. There's a lot of opportunities. Behavioral health units, huge opportunities for CNAs. So I want to come in and add that in there because I didn't mention where all you can work. Pretty much everywhere, okay? Just want to tell you.